This is still a really big issue for consumers. The differences in cost sharing for your consumers between an inpatient stay and an observation stay, which would be covered through outpatient cost sharing, either as part of your Medicare Advantage plan or in Medicare Part B, those differences in cost sharing can be massive. Good morning, insurance agents of the senior market. Welcome back to Near and Far. Coming to you on a Thursday, which isn't usually our normal day. Today is Thursday, March 11th. I was out sick yesterday, so we had Mike Asti tossing his podcast out a day early, but happy to join you this morning. As you know, here at Near and Far, we really like to stay current by searching all sorts of industry publications far and wide, and saw a great article yesterday that was actually originally published on March 5th by Dina Bunis on the AARP website. Now, AARP obviously is putting out a host of tremendous content on issues that are very pertinent to your consumers in the senior market. But this particular article I found to be incredibly interesting because it talked a lot about hospital observation status. And the article focused on a legal brief that was filed in a class action lawsuit on behalf of a number of consumers. So the focus of the article, again, is what AARP was saying in that legal brief, but more importantly, I think more pertinent to you, observation status and how it really can be impactful to consumers. So we put a link to that article in the description. I really suggest that you read it. But specific to the article, I think what it's doing is bringing to focus that this is still a really big issue for consumers. This isn't something that has just gone away. I know that many times in our offices, in your offices with your consumers, you're getting phone calls from consumers about claims that they're getting, and they're saying, wait, why am I paying all of this money? This isn't what my inpatient hospital copay is supposed to look like. Why is this expense so larger? Oh, I got this claim denied for a rehab or skilled nursing facility. And, again, observation status is something that is really confusing to consumers. And I think that's a lot of what the article focuses on, is that it is a confusing subject for a senior health. It would be confusing for me if I was in the hospital for 3 days and they told me I was never admitted. Well, what are you talking about? I slept there twice. Like, what's even going on here? The differences in cost sharing for your consumers between an inpatient stay and an observation stay, which would be covered through outpatient cost sharing, either as part of your Medicare Advantage plan or in Medicare Part B, those differences in cost sharing can be massive. So the article focuses, I think, on two key ways that this can impact your clients, and want to talk about both of them. So the primary issue is the 3-day stay rule. So for those of you that may be newer to the senior market and aren't as in tune with what this means, if your consumer is an inpatient in a hospital for 3 days, and then has to be moved to a skilled nursing facility or rehab facility, Medicare will pick up and cover that skilled nursing or rehab stay. If they do not have a 3-day inpatient stay, then the consumer's on their own. That is very pertinent when we're talking about observation status. So if your consumer is in the hospital for 3 or 4 days, but at no point would they admitted, they were just in observation status, all of a sudden they have no coverage for this skilled nursing facility or rehab stay. And that is a massive financial issue for these consumers. Now, AARP specifically is arguing for legislation and trying to push that observation stays of a certain length are considered exactly the same as an inpatient stay of a certain length, specific for qualification for payment for the skilled nursing facility or rehab. And that's something they talk about in the article. But additionally, there's a significant difference for consumers on original Medicare only, not consumers who have Medicare Supplement, but just having Medicare Part A and B or those on a Medicare Advantage plan, specific to how these costs are covered for the time they are in the hospital. So this can be a huge difference in terms of costs if that consumer is on Part B in terms of how the claims are being coded versus Part A. As you know, Part B, you have your Part B deductible, and then 20% coinsurance, uncapped, just going and going and going for that consumer who may just be on original Medicare. Now, if they're on a Medicare Advantage plan, there could be significant differences in cost sharing between the outpatient view of those costs versus the inpatient hospital copay. So even if you're on a Medicare Advantage plan, the differences in those costs for your consumers can be huge. Now, one of the other items that the article talks about is that there was a 2019 law that was passed by Congress that requires hospitals to provide a notice that explains what observation status means. But that's all well and good, but if you're, Joan Wozniak and you're sitting in a hospital bed, in Memorial Hospital in York, and they give you a notice that says, hey, let's explain observation status to you. Does that change her cost structure? Does that change the way that her skilled nursing facility or rehab facility stay might be covered? 3 days later, it does not. It's just, we'll give you some information, and it doesn't really change the outcome of what happens. So, couple of items to be very specific with you on. Number one, really should read the article. I think it gives a lot of clarity to the whole subject of observation status versus inpatient admission and how it's still going on and is still pertinent. The second is you need to educate your consumers. A knowledgeable consumer who understands those differences can ask very specific questions to their doctor and their care team at a hospital. Say, are you admitting me? What is happening with this? So they're able to try to push to be admitted as opposed to being left in observation status. So those are really key items that I think that you should be able to take out of this article. Again, still a really big subject, and I thank Dina Bunis and AARP for putting that information together and getting it in front of us. So thanks for joining us today on Near and Far. We will be right back with you tomorrow. That's right, we'll be back with you on our normal date and time on Friday at 7 a.m. on March 12th. I'm Bill, and this has been Near and Far. Have a great day.